Absolutely. So, Vijay Lakshmi, I'd like to bring you into the discussion here. Now, as Renu just said, this lack of education is a huge, huge cause for results like these. So, what would you say? Do you think it's only the lack of education or also the population, as Mr. Hota was just mentioning? What is your take on this whole thing?
Well, there are a host of factors. I think one needs to look not just at education per se, but also at, as Mr. Hota said, nutrition is a major issue. But I think one of the most important issues here is gender discrimination. When you take a look at poverty, you take a look at social exclusion, and then you look at gender discrimination, which I think is the overarching kind of problem which leads to maternal mortality and child mortality, and especially if you look at gender disparities within mortality, it is the female infant or the female child, the girl child, who is seen as most disposable. Women are generally seen as, dispensable in that sense. So I think one needs to look at the range of issues that are here, and one begins perhaps with nutrition, then one takes a look at family planning, looking at unmet need for contraception. That's a major issue here, especially when women cannot bargain and negotiate for family planning. In that context, then education comes in. But even education, for that matter, cannot just be about bringing girls to school. It needs to look at the way education is constructed and whether it is able to challenge the stereotypes that are there, whether women are able to raise issues about their health, about sexuality, about safe sex, about all those issues just by the kind of education they have. If they are not, then education is also not going to be able to deliver. I think that's something that needs to be looked at when you look at these issues. A rights-based approach and a life cycle kind of an approach to the issue is important.
Right. Vijay Lakshmi, I think she's really rounded up this whole thing, that this is all which are the factors. So, Dr. Suchi, as you just said, that gender discrimination. But as doctors, do you really see this happening? And if you do, what are the kind of cases that really come along?
And as far as we can't actually mix up the female feticide with the
maternal
mortality.
Absolutely.
They are two different issues.
Yeah.
But as far as maternal mortality goes, I don't think gender discrimination comes so much in place as far as this is concerned. But yes, I will agree with Mr. Hota. The nutrition, the factor is a very, very important factor for us, because hemorrhage is one of the leading causes of maternal mortality. And this is something which we really cannot prevent. It happens. The placenta can be in the upper segment, or she can just bleed after delivery, which can happen to anyone. Any lady who is delivering. But the basic idea is, if their hemoglobin is good, like 11 grams as per the WHO standards, they are not anemic. So when they lose this blood, which is unavoidable at times, so they are able to withstand that blood loss. So I'll put up first the nutrition there. I mean, when you, if I examine 100 women in a busy OPD of our hospital, I think around 60% of them will not be having hemoglobin of 11. So that is one of the major factors. And second important factor is they never go for checkups. And our second, the important mortality factor, the direct cause is the blood pressure, the hypertension. So they don't access any health care service. For that, I told you that they have to take a permission. There, I think a little bit of gender bias comes. So she has to wait for the husband. If not, then the mother-in-law has to give the permission, if she really can go to the hospital and show herself to a doctor. So these are the two main leading causes where, but I don't think gender will come so much in play. Nutrition, I'll put it as a number one. If they are healthy, so the chances of them dying during labor delivery is less.
Right. So, Mr. Hota, would you agree with her that yes, this is one of the major causes? And when we talk of nutrition, somehow the Indian women still, have this in the back of their minds that they need to feed the whole family first, and if they will eat at the end, they may, or sometimes they may even go without eating.
Ma'am, there is a gender discrimination at such late age of my life. I do think about it. Dr. Saab may also consider what I am saying. Motherhood is one of the most important activity, and if it's a two-term pregnancy and two children theory now, then only two most important events of the family, but the due importance is seldom accorded. Even my wife, who's my equal and educated and also a civil servant, she got pregnant and she was to deliver. I didn't make any special arrangement, thinking my mother delivered, she would deliver.
Right.
What is so important. So it was a mindset. And now that I have been sort of chastised by looking after this sector, I realize how this is widespread. And importance is not there. Antenatal care.
Right.
Nobody bothers about it. Our women also have heard antenatal care. If you take those iron folic acid, then the baby will become big and you will need surgery. This is the superstitions.
Right.
This is the belief.
These are the beliefs, right.
So we are all accustomed to low-key life for the woman, even as a mother. That the woman, motherhood is the most important event in the family. At a certain age, with certain preparation, it should take place.
Right.
But I would like to come back to service delivery. These are the realities.
Mr. Hota, I'll have to come back to you because right now we are joined by Shankar from Rajasthan. So Shankar, if you can hear me, welcome to the show.
मैम
Shankar, yes, very quickly.
जानना चाह रहा था
जी.
ये जो आप जेंडर के बारे में डिस्कस कर रहे हैं, आप जो जेंडर के बारे में डिस्कस कर रहे हैं, तो इसके अंदर सबसे पहले तो जो फैमिली के अंदर महिलाओं में खुद को इसमें अवेयरनेस आना जरूरी है.
जी. Well,
उसकी जो दादी होती है घर में, माँ होती है, एक महिला को 2 बच्चे हो गए और तीसरा बच्चा अगर फिर फीमेल हो गई तो पूरा घर है वो उस महिला से एक्सपेक्टेशन तो लड़के की रखता ही है
जी.
मगर फिर अगर वो बाई चांस लड़की हो जाए तो वो उसका एक टॉर्चर सा रहता है
जी.
और सेकेंडरी जो लोअर इनकम ग्रुप के लोग हैं उनको तो उनकी बच्चियों को तो स्पेशली वो फिर जस्ट ए लेबर चाइल्ड लेबर में वो बच्चियां इधर उधर काम करती रहती है.
जी शंकर जी, मुझे समझ में आ रही है आप क्या कह रहे हैं. वैसे आप जो फीमेल फीटिसाइड की बात कर रहे हैं वो डेफिनेटली बहुत सीरियस है हमारी कंट्री में. बट टुडे वी आर एक्चुअली ट्राइंग टू टॉक अबाउट थिंग्स विच कम अ लिटिल अर्लियर. वी आर ट्राइंग टू टॉक अबाउट maternal mortality. But I'm very happy that you really brought that up, as that is a very sensitive issue within our country. Well, at this point we'll have to slip into a very short break here in Gender Discourse, but people do come back quickly as there's a lot more on the other side. Welcome back. This is Gender Discourse, and today we are talking about the state of the world's mothers. Well, before we went into the break, we were trying to talk about the role that nutrition plays in a pregnant woman's life. So, Mr. Hota, before I ask you my next question, let's take a look at these facts about maternal mortality.
Maternal death is defined as the death of women during pregnancy or childbirth. It could also be within 42 days of termination of pregnancy. In India, 301 maternal deaths take place per 1 lakh live births. India aims to reduce maternal mortality ratio MMR to 100 by 2010. MMR is higher in Orissa, Bihar, MP and Uttar Pradesh. It's highest in Uttar Pradesh at 517 and lowest in Kerala at 110. According to a UNICEF's report, 78,000 women die annually in India during pregnancy or childbirth. The causes of maternal death are hemorrhage, sepsis, toxemia of pregnancy and abortions. 2/3 of Indian women still deliver babies at home. Anemia is responsible for high MMR. 50% women in age group of 15 to 49 years are anemic. According to the UNICEF, child marriage in India endangers maternal health. 40% of world's child marriages take place in India. The Health Department has launched maternal death audit. The aim is to correct the strategy to save mothers. The government is now encouraging public to report maternal deaths. Anganwadi workers and ASHA are actively involved in these efforts. The Union Cabinet has approved annual health survey under NRHM. Bureau Report, Lok Sabha TV.